Alanine transaminase, also known as ALT or SGPT. SGPT serum glutamate pyruvate transaminase. ALT is an cytoplasmic enzyme. Normal range 5 to 14 units per liter. Elevated level of ALT may indicate alcoholic liver disease, cancers of liver, hepatic or inflammations of the liver, non-cancerous tumors of liver, used to medications or drug toxic to the liver, cirrhosis, scarring of the liver, death of the liver tissue. Alkaline phosphatase (ALP). ALP occur in all tissues, especially liver, bone, bile duct, kidney, and placenta. The ALP used to help diagnose certain liver diseases and bone disorder. Normally 30 to 95 international units per liter. ALP is a hydrolase enzyme responsible for removing phosphate group from many types of molecules, including nucleotides and proteins, most effective in an alkaline environment. Levels are significantly higher in growing children. A rise in serum ALP normal usually associated with elevation serum bilirubin in an indicator of biliary obstructions. Obstructive post-hepatic post-hepatic jaundice. ALP is also elevated in cirrhosis of liver and hepatic tumors. This is microsomal enzyme known as gamma-glutamyl transpeptidase, widely distributed in body tissues including liver. Measurements of gamma-glutamyl transpeptidase activity provides a sensitive index to assess liver abnormality. The activity of this enzyme almost parallels that of transaminase in hepatic damage. Normal range 10 to 15 units per liter. Serum GGT is highly elevated in bilirubin obstruction, biliary obstructions, and alcoholism. There are two types of cells are present in liver: biliary cells and hepatic cells. Several drugs, phenytoin, induce liver synthesis and increase this enzyme in circulations. S nucleotidase, normal range 2 to 15 units per liter. The serum actively elevated in hepatobiliary disease that parallel ALP, not altered in bone disease. Metabolic capacity. Galactose tolerance. Galactose is almost excessively metabolized by liver. The liver functions can be assessed by measuring the utilizations of galactose. The subject is given to intravenous administrations of galactose about 300 milligram per kg bone weight. Blood is drawn at 10 minutes intervals for the next 2 hours of galactose estimations. In the normal individuals, the half-life of galactose is about 10 to 15 minutes. This is markedly elevated in hepatocellular damage, infective hepatitis, and cirrhosis. Synthetic functions. Serum albumin. Albumin is solely synthesized by the liver. It is a half-life of about 20 to 25 days. It is a good marker to assess chronic and not acute liver damage. Low serum albumin is commonly observed in patients without severe liver damage. Albumin is also decreased in malnutrition. Functions impairments of liver is frequently associated with increased synthesis of globulin. Cirrhosis of liver causes a reversal of albumin globulin or Ag ratio. Serum electrophoresis of protein reveals increased albumin and decreased gamma-globulin concentrations. The prothrombin test. The liver synthesizes all factors concerned with blood clotting. All decrease in concentrations of plasma clotting factor is found in impairment of liver function. Prothrombin time is prolonged in patients with the liver damage compared to normal. It generally falls 10 in second. S. Detoxification. The liver is major sites of metabolism of xenobiotics. Detoxification. The measurements of hypuric acid synthesis in an ideal test for assessing the detoxification functions of liver. Hypuric acid is produced in the liver when benzoic acid combines with glycine. About T of sodium benzoate dissolved about 20 to 50 milliliter water. Reference: the book is by